Skin rash can be red, inflamed, dry, itchy, and painful. So main cause is uh, dermatitis, and other cause may be bacterial, viral, skin infection, autoimmune disease like psoriasis and eczema. The types is macule. Macule is mainly flat, and this is macule. Macule is a flat, thickness less than 1 centimeter, and mainly non non palpable. And here papule is, this is a papule, mainly palpable, solid, elevated, and thickness less than 1 centimeter. Vesicle is a, this is a vesicle generally seen in chickenpox. It is elevated and contain fluid. Similar, fistule is a vesicles plus pus. Bulla is a vesicle more than 1 centimeter, and nodule is a deep seated. So, diagnosis of various skin rash is done by first biopsy, sample taken from fluid. Second is allergy test. Patch test for allergens. Also, third, blood test, increase in IgE level in a blood. So, treatment is mainly given is antihistaminic, orally, steroids like prednisolone, hydrocortisone, orally, can be topically. Steroid also causes anti anti-inflammatory action, so it is beneficiary. So macule papular rash means macule plus papule present. So macule papular rash is a and its example are, so macule papular rash is a very much important for upcoming exam. In MBBS, in NeetPg, in Inicet, and also in fmge. So example is a must know. Various examples are important. Example is dengue. Any drug eruption, Epstein virus, and Epstein Barr is a main. Also, in secondary syphilis, typhoid, leptospira, toxic shock syndrome, and rickettsia. These are main example for maculopapular rash.